Hi, my name is Dr. Nadira D. Coles, and I will be going over some information regarding prostate health. I hope you enjoy it, I hope you like, and I hope you share with your family members and friends. So our objectives for today's presentation is that the learner is able to define what the prostate is and its function, name prostate conditions, name prostate tests, describe prostate treatments, identify risk factors, name complications of prostate conditions, and name some preventions for prostate cancer. So, what is the prostate? Prostate is a walnut-sized gland located between the bladder and the penis. The prostate is just in front of the rectum. The urethra runs through the center of the prostate from the bladder to the penis, letting urine flow out of the body. The prostate secretes fluid that nourishes and protects sperm. During ejaculation, the prostate squeezes this fluid into the urethra and it's expelled with sperm as semen. The vasa deferentia, which is also known as the vas deferens glands, bring sperm from the testes to the seminal vesicles. The seminal vesicles contribute fluid to semen during ejaculation. So here we have a visual of the male anatomy. As we see, the bladder is right above that walnut-sized shape, which is the prostate. As you look below and above, and you can kind of see it behind, you'll see the urethra that runs straight through the prostate into the bladder. So some prostate conditions. We have prostatitis, and what that is, that's inflammation of the prostate, and it's sometimes caused by infections. So if it is caused by an infection, it's typically treated with an antibiotic. Then we have an enlarged prostate. Some know it as BPH. So BPH stands for benign prostatic hypertrophy. So prostate growth affects virtually all men over the age of 50. Symptoms of difficult urination tend to increase with age. Medicines or surgery can treat BPH. Lastly, we have prostate cancer. Prostate cancer is the most common form of cancer in men besides skin cancer. But only 1 in 41 men die from prostate cancer. So surgery, radiation therapy, hormone therapy, and chemotherapy can be used to treat prostate cancer. So some men choose to delay treatment, which is called watchful waiting. So this photo right here is another visual of the male anatomy. To the left of our screen, we have a photo of a normal prostate. As you look at this photo, you can see where the word says urine, that's your bladder, and that's the urine flowing freely through the urethra. So the urethra is nice and open where the urine can flow through. Now to the right of our screen, we have a picture of an enlarged prostate or BPH. As you see, the prostate is enlarged and it presses and compresses that urethra, making a narrowing effect. So the urine, where the word says urine, the urine flowing from the bladder down is going to have a more difficult time passing through because it's narrowed. The urethra is narrowed right there where the prostate is coming around it. So some tests regarding the prostate, we have the digital rectal examination, which most men do not like this examination. Just the thought of it deters them from getting their prostate checked. But this examination is when a doctor inserts a lubricated gloved finger into the rectum and feels the prostate. So a digital rectal exam can sometimes detect an enlarged prostate, lumps or nodules of prostate cancer, or tenderness from prostatitis. Then we have prostate-specific antigen test, which is also known as the PSA test. And that's done by drawing some blood. So the prostate makes a protein called PSA, which can be measured by a blood test. So if the PSA levels are elevated, then prostate cancer is more likely, but an enlarged prostate can also elevate the PSA level. So some recommendations about whether or not a man should be screened and at what age, it differs. So talk with your doctor about whether you need testing and the potential benefits and risks. So then we have the prostate ultrasound, and that's done by a transrectal ultrasound. So an ultrasound probe is inserted into the rectum, bringing it close to the prostate. So ultrasound is often done with a biopsy to test for prostate cancer. So that biopsy is done by inserting a needle into the prostate to take the tissue out to check for prostate cancer. And this is usually done through the rectal area. So some treatments for our enlarged prostate, also known as BPH. We have medications called alpha blockers. These alpha blockers helps relax the muscles around the urethra so that the urine can flow more freely. Then we have a class of medications called 5-alpha reductase inhibitors. These medications reduce the level of a certain form of testosterone, DHT, and the prostate shrinks when less DHT is present, and that helps to improve the flow as well. Another treatment option for enlarged prostate would be surgery. So usually with BPH, medications do resolve the symptoms of an enlarged prostate, but some men require surgery to improve their symptoms and to help prevent complications. So some treatment options for prostate cancer. So we have a prostatectomy, which is the removal of the prostate altogether. And the goal of that surgery is hopefully the cancerous cells are contained in that prostate. So once the prostate is removed, then the cancerous cells are assumed to be removed. Then we have our radiation therapy. So radiation therapy, it kills prostate cancer cells while minimizing damage to healthy cells. We have radioactive seed implants. So instead of radiation being pointed at the prostate from outside the body, radioactive seeds can be implanted into the prostate to kill those cancerous cells. Then we have cryotherapy. Cryotherapy involves killing prostate cancer cells by freezing them. We have hormone therapy. So prostate cancer cells grow in response to hormones. So hormone therapy actually helps block that effect from taking place. We have chemotherapy. So when prostate cancer is advanced, chemotherapy may help reduce the cancer spread. So watchful waiting, as we mentioned earlier. So since prostate cancer is often slow growing, some older men, as well as their doctors, hold off on treatment and wait to see if the cancer appears to be growing. So if it's not bothering you or spreading or moving, then we are not going to bother it. But that's watchful waiting. So clinical trials, these are research that's done by volunteers regarding new medications for prostate cancer. So some treatments for prostatitis. So depending on the type of prostatitis, whether it's acute or chronic, some treatments include antibiotics, other medications, and or surgery. So factors that can increase your risk of prostate cancer is your age, your race, your family history, and obesity. So some complications that can come from prostate cancer and or its treatments include cancer spreading to other organs, nearby organs, such as the bladder. So that's called metastasis, or it metastasizes. Also, we have incontinence. So incontinence is when your urine comes from you. You cannot control your bladder function, so you're urinating on yourself. So treatment for incontinence depends on the type you have, how severe it is, and the likelihood will improve over time. So those treatment options can be a variety of things: medications, catheters, and or surgery. And then another complication is erectile dysfunction. So erectile dysfunction can result from prostate cancer or its treatments, including surgery, radiation, or hormone treatments. But medications, vacuum devices, they can both assist in achieving erection, and surgery are available to treat erectile dysfunction as well. That's definitely something you want to talk to your provider about your options. So some ways you can reduce or prevent your risk of prostate cancer, or choosing a healthy diet that's full of fruits and vegetables, choosing healthy foods over supplements, exercising most days of the week, as well as maintaining a healthy weight. So you definitely, again, want to talk to your doctor about increased risk of prostate cancer. So here are some foods that'll help improve your prostate health. So below we have berries. So blackberries, blueberries, and strawberries. Those are good foods to help improve your prostate health, as well as green tea. And we also have fatty fish such as salmon, sardines, herring, trout, and mackerel. We have avocados, bell peppers, sesame seeds, and broccoli. So here locally in Delaware, we do have several links to prostate awareness and screening groups and resources. So those links are located right here. Nationally, we do have pcf.org, which is the Prostate Cancer Foundation, and then you also have the CDC. So you definitely should go online and look for some local resources for wherever you're located, but you can also talk to your primary care doctor as well as your urologist if you have one. So thank you for watching Dr. Dreedrop. Please click like and subscribe, and I hope you gain some new knowledge regarding maintaining your prostate health. Bye.